There should be no panic. HMPV virus, pneumococcal virus. It's a very common virus. It is normally causes very mild disease. In most of the cases, the disease is very mild, except in very small children or the people who are above age of 65 years or those who are immunocompromised. Those people, children who are getting very sick, have Influenza B virus. It is Influenza B virus which children are getting very sick. They are getting hospitalized and some are on ventilators also.
Influenza B is most serious as of now disease in the children. So what kind of preventive measure parents need to take at home?
Most important is isolation. They should not, luckily the government has closed all the schools. That's a very big step. Most important is to stay away from the people. It's a highly communicable disease. In most of cases, the symptoms are very mild. If the symptoms are mild, here are just running nose, a little cough and a fever, they shouldn't do anything. They should consult some local doctor, give him a paracetamol and just have a good nutrition. But the moment they feel the fever is getting high, child has difficulty in breathing, he is not able to sleep, he is uncomfortable, definitely yes, they should immediately take him to the hospital. Because I'm saying again, they need a good amount of support. I'm saying again, even today in our ICUs and HDU, there are patients who are on ventilators and HFN.
Hi, you're watching The Savera. This is Amarpal Singh before you. HMPV virus. Nowadays, it is making headlines, and as of now, as per reports, 11 cases have been detected in India. So there is a panic amongst residents in India about this HMPV virus. So to understand about this virus, we are having with us a renowned pediatrician from city, Dr. Baldeep Singh. So welcome, sir, to The Savera.
Thank you, sir. Thank you for giving me a chance to be with your audience. First of all, I think all people should understand there should be no panic. This human जो वायरस है, this HMPV virus, pneumococcal virus, it's a very common virus. It is normally causes very mild disease like RSV, respiratory syncytial virus. There is a lot of highlight and there's other things, but in most of the cases, the disease is very mild, except in very small children or the people who are above age of 65 years or those who are immunocompromised. Immunocompromised, especially those who have undergone a lot of steroids or they have undergone some organ transplantation program or because of certain disease, HIV patients. Otherwise, in majority of population, this virus does not cause anything except for a common cold and it passes off in about 4 to 5 days. I think every one of us has a common cold, it causes no other symptom. Yes, in some people who are some issues, like they're immunocompromised, you have to be more alert. And the test, the PCR test to diagnose is available in India. It's not a very expensive test, it costs about anything around 2,000 to 3,000 rupees. But it is not recommended that all patients should go for tests.
Sir, if we talk about a general parent, how they will differentiate HMPV with other respiratory problems?
So this I told you, there are other viruses like RSV virus, flu virus, this virus. There's no need to differentiate because it does not cause any severe symptoms. It's more common in winters and there's no specific treatment available for this. We don't have any antiviral drug to treat this. Since it's a very, very mild disease, I don't think the general population should have any panic on this issue.
Right.
So it's more of a hype which has been created. Otherwise, in majority it comes and goes without disturbing our normal routine.
Right. Sir, in present weather conditions, what kind of patients you are getting?
So we're getting a lot of viral illnesses, a lot of viral pneumonias. But one thing which is just a little away from this issue is those children, because I'm treating children, those people, children who are getting very sick have Influenza B virus, not this virus. It is influenza B virus, which children are getting very sick. They are getting hospitalized, and some are on ventilators also. Even in today, we have almost 15 patients admitted with us of viral pneumonias, and 4 5 of them are very sick, but they are not this virus. They are mostly influenza B virus. Now, what happens is the children who get very sick. Now, what sickness mean is they have a high fever, they have a respiratory distress, they have difficulty in breathing. First modality, what we do is do a X-ray chest after a clinical examination. Once we make out the patient is not maintaining saturation, his breathing is fast, there is a distress mean technique called as intercostal recession or flaring of ala nasal, then we get an X-ray done, and if we suspect that it is bad, then one we get an CT chest done to see the extent of lesion, or we send the flu panel. Flu panel, then we come to know it is most of the cases with us now is influenza B.
Right.
And it's a sick, it's a serious illness, and unluckily we have to just support the patients. There is no specific antiviral drug.
So, like you said, that influenza B is most serious as of now disease in the children. So, what kind of preventive measure parents need to take at home?
Most important is isolation. They should not. Luckily, the government has closed all the schools. That's a very big step. Most important is to stay away from the people. It's a highly communicable disease. To have a good immunity. If your immune system is strong, most of the time the body kills the virus. And second, now influenza vaccine is also available in India, now which is recommended to almost every child once in a year. So it gives you some immunity against these illnesses.
So, like there are many viruses now. Earlier there were COVID, and there were various types of COVID, and now HMPV, and like you said, there is another influenza B. So, at initial stage, what parent needs to do when they find any symptom in their child?
As I've told you earlier, in most of cases the symptoms are very mild. If the symptoms are mild, here are just running nose, a little cough, and a fever, they shouldn't do anything. They should consult some local doctor. Give him a paracetamol and just have a good nutrition. Keep the children well hydrated. Keep them warm. Give them a good diet. That's the only thing they require. But the moment they feel the fever is getting high, child has difficulty in breathing, he's not able to sleep, he's uncomfortable, definitely yes, they should immediately take him to the hospital. Because I'm saying again, they need a good amount of support. I'm saying again, even today in our ICUs and HDU, there are patients who are on ventilators and HFNC. This we call them high flow nasal oxygen. Some children require even 10 to 15 liters of oxygen. Such a high flow rate we need to good maintain. And most of the time these children are from the poor families because their nutritional status is not good. Since their nutritional status is not good, obviously their immune system is not strong. They tend to suffer more. So, at the first warning, my only request is, at the first warning normally is a high grade fever, patient has difficulty in breathing, they should at least talk to the specialist once. Another thing which I'd like to add is RSV virus. This year we have got a lot of patients of RSV. RSV means respiratory syncytial virus, which is very akin to this virus. They are causing a lot of breathing difficulties in very small children, especially children who are born premature or who have a we clinically called as chronic lung disease or some other factors, congenital heart disease. My just information to the people is that jinke bache, the children, the parents who have premature children with them or who have children with a congenital heart disease or some other deficiencies, that vaccine for RSV is now available, though it's very expensive. It costs 1 lakh per child. But in extreme premature, extreme low birth weight children with congenital heart, if they afford this vaccine, they should go ahead, go to the hospital nearby, tell their doctor, it's available in India now, and we have started giving to this high risk categories. It's a new addition in the Indian market. It's available since the last, I think, about 6 months to 1 year now. I'm saying again, it is not for everyone. It is not for all children. It is the children with chronic lung disease, congenital heart disease, or there are other conditions which the doctor will tell you. They must consult their doctor, and if they can afford it, they must get it, because RSV in patients, especially with the congenital heart disease, it creates a lot of difficulty.
Thank you. So he was Dr. Baldeep. According to him, people do not need to worry about the HMPV virus. Rather, the more serious virus is influenza B, as he said that many children, they are as of now on ventilator as well. So he appeal or request the parents that if their child has a high fever or difficulty in breathing, they should they should approach the hospitals, they should approach the experts regarding that, and they should get their child treated. You are watching The Savera. Amarpal Singh with cameraman Manoj Sidhu.